My name is Dr. Al Freedman. I'm a practicing clinical psychologist, and I specialize in supporting the psychological and emotional needs of patients and families affected by rare disease. I'm also a dad, and the reason that I'm focused on rare disease is because of my son, Jack, who was born in 1995 and diagnosed with SMA or spinal muscular atrophy. Jack was given 1 year to live when he was a baby, and thankfully he didn't fully cooperate with his prognosis. He lived to the age of 26. So I learned a lot from my son, and I learn a lot every day from other patients and families affected by rare diseases all around the world. I provide one-on-one counseling services to patients and families. I provide group facilitation service for rare disease advocacy organizations. I provide facilitation for many rare disease support groups around the world. I consult with rare disease advocacy leaders on how to build support programs for their communities, and I consult with industry partners on how to support the communities they serve with treatments and treatments that are in development. I'm very busy because there are very few of us at the intersection of mental health and rare disease, and I'm happy to share what I know about my work and also specifically about the XLH community. And not surprisingly to me, as someone familiar with many rare disease communities, the XLH community has significant mental health challenges. And the survey the community conducted revealed 83% of adults and 90% of children reported at least one mental health issue. But not surprisingly, a small minority of these patients are seeing a mental health professional. Not surprisingly, anxiety is at the core of many of the concerns. Those of us in the rare disease community deal with a lot of uncertainty, and living with uncertainty is anxiety provoking. So it came as no surprise to me to see that the most common mental health issue reported was anxiety. Depression was also reported, high rate of depression, and also social isolation. Many rare disease patients in this community and others experience social isolation, which is a great challenge and was a challenge during the pandemic and continues to be a challenge for rare disease patients. It comes as no surprise that attention to mental health would lag behind attention to physical health and medical issues when it comes to rare disease. I like to say, as a dad, that for 26 years, I didn't have time to talk about how I felt about my son's situation. I was busy literally keeping him alive. So we have to attend to, in rare disease, our physical condition and our medical status to keep stable is a primary need. That takes up a lot of time. It takes up a lot of bandwidth. So mental health often lags behind. The attention to mental health lags behind. And secondly, as importantly, access to mental health services is very difficult. In the United States, really our mental health system doesn't work very well. It's pretty broken. So access to mental health services for people without rare disease is a challenge. With rare disease, to find a person who can help us, who has expertise in the unusual situation we're in, is very hard to find. Having insurance cover the cost is hard to find, and there are very few mental health practitioners available. So part of this is practical challenge related to time and priorities. And part of this is our healthcare system just doesn't work very well when it comes to mental health. The first order of business is for all healthcare providers who interact with these patients to be aware that mental health challenges are at the forefront for them. And although most medical providers don't have a lot of time with each patient, it really helps when a healthcare provider gets to know each patient individually, hears their story, talks to the patient about things other than their rare disease to get to know them, and to listen up for the things that they are struggling with. Listening goes a long way. And I find as a psychologist that what I say often is less important than my presence and my availability to listen and show an interest. So the first thing any healthcare provider can do is to be open and take the time to get to know their patients and to listen up and ask questions about how a person is doing beyond the medical symptoms themselves and specific to depression and anxiety. A second way that healthcare providers can support the mental health needs of patients is to provide interdisciplinary care. Oftentimes, when I came to the hospital with my son, there were a team of healthcare professionals there that included a social worker, included palliative care, included mental health practitioners who were part of the team, which gave you an opportunity to address those issues as part of an interdisciplinary conversation rather than siloed or segmented. It was very, very hard in the beginning because I was told that our baby wouldn't live very long. And that was a really traumatic and life altering moment, the trauma of a diagnosis. And it took a while. It was very disorienting and very scary. It takes a while for most people, as it took a while for me to get my feet back under me, to reorient to this new world that I had been launched into. And it really helped me and it helps others to talk to other people who've been on that same journey. I felt like I'd been launched into outer space all by myself to a place that nobody else understood. It was other parents and other families who had kids like mine who provided me support, and I felt understood that what it felt like to be launched into that twilight zone because they'd been launched there too. And these people became role models for me. And as I work with patients and families around the world affected by rare disease, over and over, I see that same phenomenon where peer support is so valuable. And my mental health was strengthened by interactions with others in the rare disease community who had managed to survive the loss of a child or survive the hospitalization, survive the uncertainties, and learn how to manage such an unusual situation. In extension of that are support groups. I facilitate many support groups now, and rare disease patients and families are hungry for contact with others who find themselves in this unusual situation with a rare disease that nobody else has ever heard of. Mental health is strengthened when there's a community of people who support each other. Another way to stay healthy is to take care of oneself as a caregiver. The other thing I did was to do what I could to exercise and to do things that were fun and to take breaks from being a father of a medically fragile child. We can't spend 100% of our time taking care of somebody else if we don't take care of ourselves. A lot of the focus of attention when I work with family members is on taking breaks, which is counterintuitive because you're worried about your family member and you don't want to leave them alone long and you want to make sure everything's okay with them. But if things aren't okay with you, then you're not available for your family member. So a combination of self-care, taking breaks, doing things that relax us and get us pleasure and a break and exercise and hobbies and interests and work all helped my mental health combined with interacting with others in the community that the club I didn't choose to join, but the other club members welcomed me with open arms and supported me. And that's what I see happening over and over in rare disease communities, people lifting each other up and supporting each other to help strengthen each other. And many people tell me that others did that for them, so they want to pay it forward. And that's what I try to do in my work as well. It's very traumatic to find yourself in this club that none of us chose to join. If someone had told me before my son was diagnosed with a rare disease that was going to happen, before it happened, I would have said, I won't be able to handle that. Lock me up in a rubber room now. It's going to be too much for me. I found that I was much more capable than I thought I would be of managing a very difficult situation. My advice is first, yes, you can manage this situation. You can find meaning in such a difficult set of conditions. You can find strength in others who have walked the path you're walking on. And it's really important that you take care of yourself so you can take care of your family member and you can take care of yourself. And probably the most important piece of advice I'd offer to a newly diagnosed patient or family member, again, is to find your community. Find others who share the experience that is so unusual that no one's ever heard of, and who are ahead of you and have walked that path and have managed to not only survive, but sometimes thrive, even in the face of such adversity. There's strength in numbers and there's power in community. I see this over and over again. I always thank providers for choosing to get involved with the rare disease community. When you're diagnosed with a condition or your family member is, you're again launched into this place where you feel like you're all by yourself. And it's too big a job for us to do by ourselves. So the first thing I do when I meet a doctor or a healthcare provider who specializes in rare disease is to say thank you for choosing to help us. We didn't choose a rare disease. You're choosing to be involved, and you could be doing a lot of other things. So we're hot potatoes as families in rare disease, and you're willing to get in the frying pan with us. So thank you very much. And as far as advice goes, it's get to know the rare disease community you serve, attend conferences and events, get to know the people you're caring for and the challenges they face, and they will be indebted to you and feel so grateful to have you as part of the team. And take care of yourselves because we need you. And it's a stressful thing to be involved with us. It's stressful to care for families and patients affected by rare disease. And if you're doing your job, you're getting close enough to us, you're going to feel what we feel. I counsel physicians and other healthcare providers, as well as patients and families. And oftentimes, healthcare providers, industry partners, anybody who's working closely with us starts to feel overwhelmed, starts to feel a lot of uncertainty, starts to feel a lot of feelings. That tells me you're getting close enough to the action to feel the action. You're doing your job because we're transmitting, the patients are transmitting to you how they feel. So my advice is you need to take care of yourselves too, so you can keep taking care of us. We're very thankful for your presence in our rare disease communities. Anytime a person or family receives a diagnosis of a rare disease, a serious medical issue, I think for me, it was a traumatic event to be told that our healthy baby was going to die in a year. It was a major trauma. So the things to watch out for are symptoms of trauma and then symptoms of anxiety, because once you get your feet under you and adjust to this new reality that you find yourselves in as a patient or family member, you're living with a lot of uncertainty about how things are going to go, whether the symptoms are going to flare up. How long am I going to live, or how long is my child going to live? Where do I fit into the world? And is there a place for me in the world being so different? There's some complicated existential questions, and then the day-to-day stressors and uncertainties of having the proper medical equipment and supplies of proper care, what to do if there's an emergency. So anxiety can manifest itself in many different ways. And if symptoms of anxiety interfere with a person's day-to-day functioning, with or without a rare disease, that's true, then intervention may be needed. So the red flag are the mental health symptoms of anxiety or depression or other types of mental health issues interfering with the day-to-day functioning of the patient or the patient's family member. And if they are, it's important for the healthcare provider to pay attention to that need and to steer the patient to resources that can support their mental health needs. Another aspect of this is that there are plenty of people who have a predisposition to anxiety or depression or other mental health issues unrelated to a rare disease. And sometimes even therapists can miss that, because if somebody comes to a therapist in a wheelchair or with a ventilator or with an obvious set of conditions that are visible, the therapist can assume that 100% of the patient's stress is related to the life-threatening medical condition they have. And that can be true, but it also can be true that a person has a predisposition to anxiety or depression prior to having a rare disease diagnosis. And in some cases, patients I see have two problems rather than one, a medical issue and a vulnerability to mental health challenges that pre-existed the diagnosis of a rare disease. So you have to be on the lookout for that kind of vulnerability in a person. And when you're in the mental health field, as I am, you see plenty of people who have a vulnerability to mental health issues. It's not a character flaw, it's a different type of medical predisposition that can be genetically transmitted. So, all of us healthcare providers need to be on the lookout for these types of symptoms. And if they interfere with the day to day functioning of the patient or caregiver, it's important to respond. And if you can't provide the mental health support yourself, to steer them to resources who can help. There are a number of directions to go. Sometimes within a medical clinic, the hospital setting, there are mental health professionals that are part of the staff, especially a hospital that specializes in rare disease. One possibility, one source of support would be the interdisciplinary approach provided within the rare disease clinic at a hospital. A second would be a separate department within the hospital system that offers mental health support. A third source of support would be practitioners in the community around the area where the patient lives that provide counseling services. One other note there, for PhD psychologists like me, there's now a credential that's available. There's an interstate compact. So I now am able to serve patients in 42 states, and it will soon be 50 over time. I work remotely and I'm able to serve patients in 42 states. That's something new that happened as a result of the pandemic. Fourth, the rare disease communities themselves, as I mentioned before, many of the rare disease communities offer mental health support in groups and offer resources, information, support groups, and one-to-one contact with peer ambassadors, peer volunteers within rare disease communities who volunteer to support and mentor other family members, especially newly diagnosed. And many have online resources. I participate in many webinars and podcast interviews like this to help provide guide and support indirectly through those mediums. And then finally, there are umbrella organizations. NORD, the National Organization of Rare Disorders, Global Genes, are examples of rare disease specific umbrella organizations that have on their websites and within their programming a number of mental health content specific resources. And then there are broader umbrella groups like the National Alliance for Mental Health, the American Psychological Association. So there's a range of things, and it is hard, as I said, for 26 years when I was taking care of my son, I didn't have time to talk about how I felt. I didn't have time to show up anywhere easily. So having some of these online resources and informal resources through the rare disease community that I belong to was and still is invaluable. I'd like to finish with never give up. And it is a lonely and challenging and isolating experience to find yourself with a rare disease or find yourself with a child or family member with a rare disease. And isolation never helps any of us. So, my message to people who may be watching who find themselves in this situation or know patients and family members in this situation is to encourage patients and families to reach out for help from wherever help can be found so that you have a connection. You have somebody you can talk to, you have somebody who will listen to you, and you can feel supported and not alone. There are many different ways to do that. It's not easy to find help. It's not easy to find the time to set up an appointment at a specific time, but there are resources out there. There are plenty of people who care, and you shouldn't try to do this by yourself. It's too big a job. And finally, other people in 1995, all those years ago, my son would have been 30 years old last week. And all those years ago, I'm still indebted to the people who offered their support to me. And they told me that people offered support to them. And when I asked them, why are you giving me your time? What can I do to repay you for doing something so important with a perfect stranger to support me? They said, Al, other people supported me the same way when I was in distress, and you'll do the same thing someday. And in my work, this is what I do now. And I think everybody who finds themselves in this position receives support and then offers support. It's part of the natural cycle of being in this unusual situation. So don't be alone. Don't give up. Reach out if you need to talk and need support. Everybody does.